Hey everyone, thanks for watching. I want to talk today about putting dry eye into your practice and how to make it flow smoother, how to make it less of a time investment, how to keep your practice running without getting stuck with looking at dry eye, making recommendations, and seeing your patients. As you know, I'm an advocate of screening everybody. I use a speed survey for symptoms, and I look at tear quality, quantity, and I look at vital dyes. I think that's important. When it comes to the discussion about with patients that you have dry eye and you have inflammation and we're going to treat it and this is what we're going to do, I lean on my staff a lot. I lean on my staff for a lot of this gathering data and also patient education. So I will explain to the patient in the room that you have dry eye disease, we need to treat it, this is what we're going to do, and this is when we're going to follow you back. From there, what I do is I use checkboxes, and I use these sheets like this. So we had sheets made up, and I want to give credit to, this is something I put together with the help of Laura Pearman, and we looked at targets like inflammation, MGD, blepharitis, and for each we talk about what we're going to do and what it does, what we're after. I check these boxes, and then my staff will sit down with the patient. We'll put them in this folder. Right here we have these folders made up, and we just put them into this folder, and my staff will sit down at a table and review each of these recommendations with patients. That way, I think, when you talk to patients about all this, it can go in one ear, out the other. Once you talk about you have dry eye disease, they may be thinking something else. So I think it's important to send patients home with something that they can review. So my staff will sit down, make sure the patients understand. If we write an eye drop like Restasis or Xiidra, for example, we'll put a drop in that day to demonstrate how it feels to the patient so they know what to expect. We'll if we're doing lid wipes, we'll use one on the patient's eye to explain to them how to use it properly. So the staff will really educate them, make sure they are compliant. That's what we're really after. And then they'll schedule a follow-up from there. If you're interested in these sheets, you can, if you're on Facebook, we have a group called ODs for Ocular Surface Disease, and under a files section, there's a section that says, or a file that's called meibomitis. If you look at that, that's where you can find these, or send me an email. I'm happy to send them along. But again, I think it's important. Use these tools, send patients home. We also have these blink exercises we recommend for patients who are heavy device users that show signs of MGD. Caroline Blackie gave me insight into this and think that really helps keeping meibum moving. But again, use your staff, educate them on the importance of these patient communication tools, and let me know if I can get you a copy. Good luck. Thanks a lot.